Welcome to From Bench to Bedside and Beyond. Today, we're chatting with Dave Lucas and his doctor, Yaw Nyame, a kidney cancer specialist at Hutch Cancer Center, who shares Dave's passion for being active and was with Dave in spirit on his recent bike trek through Croatia. So I want to do something a bit unusual and start from the end rather than the beginning because I love this story that was shared. Uh, Dr. Naomi, you give all your patients. You said you give all your patients your cell phone number for emergencies. So Dave had your cell, and he used it. Fortunately, not for an emergency, but for something even better, to text you photos from his trip in Croatia.
He did, yeah, and it was hey, we had an agreement that at 4 weeks Dave could ride, and so right around 3.5 weeks I got the picture from Croatia, and I thought, he must be doing pretty well if he's up in the mountains riding. So it was a real treat to get what was a really beautiful picture in my on my phone.
That's amazing. Okay, so now let's walk it back a little bit. You saw Dave in the multi-specialty kidney cancer clinic because he had a tumor in his kidney extending into his vena cava, which is the largest vein in the body, and that's a pretty advanced stage cancer. And you had told me that what really stood out to you is that unlike most tumors that extend into the vena cava, his tumor in his kidney was not that large, actually, which made you feel like he might be a candidate for something a little bit different than what you often do with kidney cancer patients.
Yeah, one of the things that I think we pride ourselves on as a program is really customizing cancer care to the patient. And a lot of my patients will hear me say that we will support you in all the ways that you need to be supported, whether that's socially, emotionally, in addition to the clinical and therapeutic interventions that we provide. Tumors that extend into the vena cava take all forms, shapes, and sizes. I think for our program, we tend to see really advanced cases where the thrombus can be bigger. And so if it's complex enough, that often lends itself to a bigger approach, which means a big abdominal incision, which just takes a longer time to recover from, but allows us to do these complicated surgeries in a slightly safer manner.
Okay, so you had mentioned to me that we have this really very robust robotics program here at Fred Hutch, but you had not yet approached a tumor like Dave's robotically. What is the reason for that?
Yeah, we do take out some thrombuses robotically that are extending into the vein that goes to the kidney. But once you start having extension of a tumor into the vena cava, it's kind of, I always joke, we're plumbers, right? There's just more water supplies that need to be shut off because this is kind of a main thoroughfare of blood flow. And so it just makes that turnoff of blood process more complicated. So if it's not extending too far into um, the venous system of the kidney, if you will, then there are maneuvers we can do to get that enough room that we can safely divide using usually a stapling device to remove that thrombus. But once it gets into the vena cava, then we have to be able to essentially clamp three different points in the vena cava off completely so that there is no blood flowing into our vena cava when we open it, because right, we got to make an incision in it. And traditionally, we've done that with an open approach. And there are some advantages to open surgery, right? Especially if we need to do a lot of sewing or fixing of things. But again, I think a strength of our program is we're not a one size fits all program. And I think standing in clinic, looking at Dave, he barely sat down. It was clear he was very, very active. And one of the first things he really mentioned was that he and his wife had planned a bike trip that meant a lot to them. And it was clear that being able to make it to that trip would be meaningful to him. It's almost as if the stars aligned because when I looked at his scan before I met him, I thought to myself, this might be one of those cases that's amenable to a robotic approach, something that we've been planning for. And Dave uh, seemed to be the perfect patient with regards to motivation to be willing to have us try that approach so that he could have that benefit of a faster recovery.
So I also remember that you had mentioned to me that a goal of yours is really to meet patients where they are, and then lo and behold, here is this very fit guy, and one of the things he mentions is this bike trip to Croatia that he's got coming up. So um, kind of when you say you felt like the stars aligned, it was like in that moment you felt like his personal goals of surgery or how quickly he would want to recover from a surgery, what he wants to achieve in the very short term would actually align with something much less invasive than what you historically had been doing with patients like him.
Yeah. And again, one of the things that occurred with Dave is I was very upfront. Look, Dave, there are two ways we can do this. One of them is the traditional way we approach this. It's an incision through your six pack muscles. It's a longer recovery, but it's the tried and true way that we've approached this. And there's a robotic approach that I feel comfortable with for these reasons, that we would have a really good contingency plan for who would be around, and especially during some of the critical portions of that surgery, just to make sure we were safe. And I was very upfront that even though we hadn't done it, this is a program that does a lot of robotic surgery, and I myself do, over 100 robotic surgeries a year, and they're all complex, and all the different things that I do for other approaches, whether it be bladder cancer or prostate cancer or even other types of kidney cancer, are all applicable skills that would transfer over to his surgery. So, I think I didn't come into the room, and I hope Dave corroborates this. I didn't come in the room and say you're having a robotic X, but I wanted him to understand what the benefits of those two different approaches would be. And when he said, "Well, trying to get to Croatia," it seemed like, okay, well, I think
Yeah.
we're both seeing an opportunity to take this approach that I thought was safe, and ultimately, I said this to Dave, my this is a line that I stole from one of my partners, John Gore, but our goals as a program are always the same. One is patient safety. We want to do your operation as safely as possible. And that's 1A, and 1B right below it is to do a good cancer operation to get him cancer free. And that has remained the goal since the time we met in that multidisciplinary clinic.
Okay, well, that's a perfect transition into getting your perspective, Dave. So we've already established that you're a very active guy. You're 71, is that right?
Correct.
Okay, you're from Anacortes, and you've also had a couple of previous brushes with cancer. And then you had this bike accident earlier this year in the springtime that set you on a very different course from what you were expecting. So I was hoping you could tell us a little bit about how you found out that you had kidney cancer.
Yeah, interesting summer. In June, out bike riding with friends in the Skagit Valley and hit a seam in the pavement at about 20 miles an hour and suddenly on the ground, taken to Skagit Valley Hospital and broken ribs, deflated lungs, separated shoulder, concussion, neck injury, usual stuff. And the next morning, I had a urologist come in and said, "Oh, we ran a CT scan on you, just see if anything else was wrong. Did you know that you had a tumor in your right kidney?" And no, I did not. And then it's like, okay, so what are my options here? And up there, they said, well, we've already sent in an urgent referral to Fred Hutch. Give them a call in a day or two, and they said that Fred Hutch would call me, which they did,
Mhm.
and started the ball rolling.
Okay. So I remember one thing when you and I had spoken, Dave, that you told me, you said you're a very positive person and that your viewpoint on life is, okay, if something is my reality, then rather than get really down about it, rather your approach is, okay, what are my choices? How am I gonna tackle this? What am I gonna do about it? So very very action oriented and very very optimistic.
Correct. Up in the hospital in Skagit, rather than thinking, "Oh, how did this happen? Why didn't it?" It's
Hmm.
okay. It is my new reality. Where do I need to go? Who's the best people to talk to? Once I met Dr. Nyame, then it was what can we do? What's the best way to do this? And one of the things I really enjoyed was the conversation, being able to talk about the two different options, pluses and minuses, and coming to an agreement that, well, in my case, I'm comfortable. Let's do the robotics because it should be a shorter recovery. I can make my trip, and it all worked out.
Yeah, yeah. And you had also said that you really appreciated um how how when you were in your appointment, Dr. Niami kept stopping to check to make sure that you were understanding what he was saying. You appreciated his just his manner, the way he wasn't directive and saying, I think we should do this, but presenting all the options. And then you both jointly decided that, yeah, robotic surgery seems like the way to go. So, did I summarize that correctly?
Correct. What I'll add in there is from the moment Dr. Nyame walked in, he's a very engaging person. He focused on me. Um, at all times, there was the pausing and looking to make sure that I had a chance to engage back, that it wasn't just a doctor talking to a patient.
Hmm.
I still remember him pulling out a piece of paper and drawing a picture of my kidney and where the tumor was, how everything was set up, what he would do. And those sort of things gave me confidence that I'm in good hands.
Okay. So you had the surgery. Then I think there were 2 weeks of walking, 2 weeks where you were allowed to walk, another week on your stationary bike. Then you got on your actual bike to get some miles in. You got 2 or 3 rides in, and then you left September 2nd, I believe it was, for Croatia, and you started your ride with your wife.
Correct.
And
Correct.
you felt a little weak, you said, but really no pain, which is wild to think about that you've just had surgery and you were not in pain. You were riding 25 to 30 miles a day, 8 days
Correct.
of cycling in this trip, and
Correct.
you were feeling great.
Yeah, I I shouldn't say I was amazed because it's what I was hoping for and expecting,
Yeah.
but it was really nice to have the warm up rides here in Skagit County, spend 12 hours in a plane to get there, and then a couple of days of walking around, getting used to time zones, and then jumping on a bike and up and downhill. And by the way, Croatia's beautiful. Go.
Yeah,
um,
I will add the for us, one of the things that's a real strength of our program is that we are very well equipped to take care of complex cancer patients. And, what Dave had was a complex cancer problem. And it's a lot of preparation. And for me, especially, it's like, it's one thing to know what to do, which was the case, but there's the devil's in the details. This is what I tell our trainees all the time, right? The devil's in the details. And so it's all the little things, right? If I'm going to clamp this exactly, like, what do I do at this step? And, fortunately, I've got a lot of close colleagues from my prior training in Cleveland, and just friends across the country that I could tap into to say, okay, I know you've done this or you've done a few of these. These are my very specific questions. So a lot of preparation, and maybe a little bit of lost sleep the night before, Dave, if I'm being honest, because it's a new thing, right? You want
But
to make
hopefully
sure
not too much.
not too much, not too much, but you want to get it right? Because we're dealing with people, right? And
Yeah.
that's really important to me that we give you our best shot. But what was incredible for me was that was kind of the village that came together on the day of surgery. You're asleep, but one of my partners came in to check in and see how we were doing. We have a transplant surgeon that we collaborate with in these thrombus cases frequently, and he actually took time from some personal obligations to just be there during the most critical time when we were opening the vena cava, and was there present. At some point, I looked up, and some of our residents who were out of their other surgeries were in to support and peek and learn, and it felt like our whole program was coming together to make sure we were serving you. And the very next day, the next morning, our chief resident rounded on you, and he texted and said, "I think you can go home today." Which, just for context, that never do we do a thrombus case and send someone home the day after surgery. I mean, you're with a traditional incision, you're usually hanging out with us for a few days on the early side. So it was really fantastic to see it all come together. Um, and then to have you share those pictures of you riding up in the mountains with your wife, I think really was the cherry on top. So, I wanted to add that as some context to, how it all came together so beautifully, and it's been really a privilege to be part of the team that's been supporting you, Dave, in this new chapter of your life, being a cancer survivor, or as the advocates I work with would say, cancer thriver. So.
Catch a thriver. Yeah.
I like it. I like it.
Yeah.
I will keep that.
I don't know how to top that. I had a couple more questions, but I think that this is a really beautiful ending. Um uh just I just wanted to reiterate, August 6th was your surgery, Dave, and September 8th you texted those photos to your doctor. Um that's just amazing and inspiring, and I think, Dr. Nyame, you said that Dave's first question was, "When can I get on the bike again?"
Yeah, he was committed.
Yep.
Yeah.
You're always nervous, but I think at that 2, 3 week mark, and I said, as long as you're going light on the bike, I don't even know what that really means, going light on the bike, but as long as you're not straining and you're just getting your heart rate up, I think, yeah, that's okay. So he followed it, all the instructions to the letter of the law, if you will, and time had kind of escaped me. So I was, when I said, has it really been a month? That's just kind of what's
Yeah.
happened in my phase of life now with young kids and a busy surgical oncology practice. I said, Dave, has it really been a month? It feels like it was just yesterday. And sure enough, he had hit it right on the mark. So
Yeah.
that was great.
Well, thank you so much. I also just wanted to just point out, Dr. Nyame, on your bio on the Fred Hutch page, like the bio, that if people are looking for a doctor and they're Googling and your profile comes up, you have this quote. I don't even know if you remember saying this quote, but it intersects so closely with what you've been talking about today that I just wanted to read it. You said, "The greatest pleasure of my job is getting to know my patients, understanding what drives them, exchanging stories, and learning about the impact of their disease. These personal details help me provide comprehensive, individualized care." And I read that and I'm like, boom, this is exactly what happened in this case, where you were willing, not only willing, but motivated to think, okay, what kind of surgery, what kind of approach works best for this particular patient.
Yeah. Thank you for sharing that with me. It's been a while since I've
I
seen that quote.
figured. I figured. Anything that you would like to add, Dave?
I think One of the biggest things I took away from Fred Hutch writ large is how everybody there is very caring, very engaging, very focused on the person in front of them. Um, in addition to being very good technicians and a wonderful surgeon, that interaction was was comforting. What made me trust, know it was going to turn out well. That it just lowered all of the little bits of worry that were there. Um, I don't know what kind of a box to put that in, but that was just really important um, to feel.
Amazing. Well, thank you. Thanks so much to both of
Thank you
you.
for sharing that, Dave.